Hey everyone, it's Anastasia, Anastasia's Hump Day Happenings. I'm going to answer a viewer's question this week regarding how do I find a new dentist? I'm so excited that you came to me with that because, sometimes when you move to a new city, one of us has to take one for the team, and apparently you are. And this is for your husband and your kids also. So really important to understand that you are also interviewing the dentist, the hygienist, or the practice, because this is a health and wellness journey. And you want your experience to be one of empowerment, not coming from a place of fear, right? So here's a couple of areas to prepare for, to ask. It's about technology, time, payment options, and social media. Let's get started. So I would ask the dentist, if you're going to sit down, maybe even have an interview with them, I would ask about their x-rays, their x-ray machine, how much, how often do you take x-rays? What is your philosophy on this? I'd ask about crowns. Do you have the technology where you can have the crown done the same day? Or do they use a lab where you're going to have to come back for it? Cosmetic procedures, whether it be veneers, bonding, botox. I would ask to see, as far as this goes, can I please see before and after photos that are very recent, and in addition to patient testimonials? What about dental implants? Do you do the following? Do you do dental implants, orthodontics, sleep apnea? Do that in office, or do you do that outside and refer to different specialists? It's really important, at least you know what you're dealing with, because sometimes it takes a lot to get to the dentist and then you're like, oh my gosh, I have to go somewhere else. So get this out of the way, and that way you know what you're dealing with. Now, occlusion would be one I would ask about, because there is technology to talk about your biting forces, but it's important to know what's going on TMJ wise. Your bite's gotta be right. And then finally, it's probably the most top requested service. Do you have in-office whitening? And I'm here to tell you, this should be the answer once you ask, do you have in-office whitening? Yes, we do have in-office whitening, and we'd love to see if you are a candidate and see if your enamel is healthy, to see if your gum and bone are healthy, your foundation is healthy, so we can move forward to see also what is staining your teeth, and we can maintain the lighter shade versus keep going over and over and over. If they don't have anything, if the answer is nothing to that, and just say, yes, let's just jump right on in and do in-office whitening. Okay. Is that really in health and wellness? I'm just saying. Let's go to dental hygiene. Dental hygiene visit is a health and wellness visit. It is not cleaning. Technology in dental hygiene to ask for. Do you have an intra-oral camera? What caries risk assessment tools do you make, and how do we work through that? Caries risk is risk at tooth decay. You should know, are you at a mild, moderate, or high risk for tooth decay? Do you have oral cancer screening technology? And how does that work? How often is that done? How often do they periodontal chart you? That is taking a probe, and we're measuring the gum and bone around each tooth, which is 1, 2, and 3 are healthy. Bleeding points, if any, we're measuring. Recession, wear facets, enamel, whether there's decalcification or the white spots around there is what we're measuring. That should be done at a minimum of 1 time a year. Ask the dental hygienist, hey, if you're using ultrasonic instrumentation, of course, hand instrumentation, how often are these instruments replaced? Time is really important with a dental hygienist. It should be a minimum of 60 minutes, and here's why. The very first thing that they should be doing is a blood pressure on you to document. And you know what, if you've had breast cancer treatment, you should definitely share so the blood pressure cuff is not placed on either arm that is affected. We do not want lymphedema to happen. So blood pressures should be taken every time to document. All right, so after that, discussing the entire health history. So maybe you have dental fear or dental anxiety. Ask, hey, do you treat it with prescription, or can I use CBD oil? What's your thought on that? And how do we go about that? I would ask about vaping. I would ask, what should be asked of you is, have you had your HPV vaccine? Here's why I ask. HPV, the virus, is related to oral cancer. Go over the symptoms. This should all be discussed. Now, after the time, products. It's an oral fitness regimen, toothpaste, mouth rinse, in between cleaning, very different, and it should be customized to you. It's not a one size fits all. All right, so after that, I would now ask, what payment options do you have? I'm here to tell you we should all have a financial option placed to us, and that is, I would prefer care credit. And the reason I say that, if you already have a care credit card, let's say for Gibbs, veterinarian, you can use this for, for your eyes, for hearing, for plastic surgery. Care credit helps you gain health. And finally, social media. Look at the website. Is it current or is it kind of outdated? I'd look at the social media pages of the dental practice and look at something that maybe interests you. Is it relatable? Does it empower you to ask a question? Because let's say you go in and sometimes I'd forget. Maybe my patient would say, I have celiac disease. You should have on your sites, there are oral side effects to celiac disease. Do you, have you had trouble breastfeeding your infant? Did you happen to know that an infant who is tongue-tied has problems breastfeeding? There's so many things to go over oral health-wise that could be placed on social media pages. Or, hey, hire Anastasia. This is what I do. At least this is something to get you started to find your new dental home. I applaud you for doing that, and I hope this helps you out. Now, you got a question for me? Ask it. I'll answer it on a future episode. Otherwise, like this channel and join me every single week. Until next Wednesday, take what you learn and make a difference with it.